Pathmonk is the intelligent tool for website lead generation. With increasing online competition, over 98% of website visitors don't convert. The ability to successfully show your value proposition and support visitors in their buying journey separates you from the competition online. Pathmonk qualifies and converts leads on your website by figuring out where they are in the buying journey and influencing them in key decision moments with the relevant micro experiences like case studies, intro videos, and much more. Stay relevant to your visitors and increase conversions by 50%. Add Pathmonk to your website in seconds. Let the AI do all the work and get extra 50% more qualified leads while you keep doing marketing and sales as usual. Check us out, pathmonk.com. Welcome to today's episode. Let's talk about today's guest. We have Alexander Kerman from Ubie Health, head of growth with them. How are you doing today, Xander?
Great. Excited for the conversation.
Excited to learn a little bit more. And well, I'm sure our listeners are tuning in, wondering what Ubie Health is all about. So in your own words, Xander, tell us a little bit more.
Great. So in a 20,000-foot view, Ubie is all about helping patients find the right type of care at the right time. So the easiest way to think about what we do is we're basically using AI to create a better WebMD or a better Dr. Google. Because right now, patients are left to figure out what is relevant to them with very limited context. How are patients supposed to navigate to the right resources, to the right disease pages without a medical background? So what we're doing is we're using AI to personalize that process and to match the right patients with the right information at the right time, and then help them pursue the definitive care afterwards. And basically what we do from there is we also help our life science clients or pharma clients, as well as healthcare providers, deliver better care, and both via marketing as well as some workflow tools for providers.
Definitely love that, right? Because like you mentioned, right, I think we all started with WebMD, and it was kind of like the only resources, and you couldn't trust it. I remember when I first started, right, it was kind of like, oh, let me check, and I have a symptom, and ended up having a disease, and I was like, you would get scared, right? So definitely great.
Exactly. We've all had that experience where we go on WebMD or Google with a headache and leave thinking we have a brain tumor. That's not serving anyone. It just is actually probably delaying more care than it's facilitating. So we're all about getting better conversations into the clinic and helping patients get on the right treatment quicker.
Definitely important. All right, awesome. And so that that way our listeners could get a good understanding there of Ubie Health. What would you say then is those key problems that you're looking to solve for potential patients?
Yeah, so for patients, the biggest thing is, what do I do? Do I need to go to the hospital? Do I need to go see my primary care physician? Should I go see a specialist instead of that? So that site of care question is huge. But the bigger question is, once I'm in to see a doctor, what information do I need to make an informed decision? So again, right now, it's really, really hard for patients to find the right resources. Even with all the money that pharma throws against their brand websites and disease state awareness campaigns and all of this stuff, patients aren't finding the right stuff. Patients prefer third parties. They view pharma's own site information as biased. They just have trouble finding it in the first place. So that's a big part of what we're doing, is just helping patients get the right resources for them. That personalization is a huge part of what we do. And to your point around avoiding fear, I was just reading some patient testimonials. One of our users actually thanked us for not saying that they had cancer and not saying that they needed to go to the emergency room right that second, because that's been the approach. Older tools that are not as smart they're just risk averse. They have to be. They're not sensitive enough to make sure that they aren't missing important diagnoses. And that's our superpower. We have 1,700 hospitals and clinics in Japan that are providing feedback into the algorithm, where doctors are telling us, was that a good recommendation? Was that not? And that allows us to reach about 90% accuracy. So about 87% of users who go see a doctor will get diagnosed with one of the diseases that we surface to them.
Wow, all right. That's some great statistics there. So talking about that, right, you mentioned right now how many patients or clinics that you have in Japan. Is there then a certain vertical segment that people can use Ubie Health for?
Yeah. So, I mean, from a user perspective, anyone and everyone should use Ubie. It's free. There's no registration required. Just go to ubiehealth.com, get started right away. It's not even, you don't even have to download an app. It's all web browser based. Super easy. What the vertical that we serve, though, our monetization approach, as I mentioned, is primarily biopharma. We're mostly going to big pharmaceutical companies and smaller ones as well, and working with their marketing departments to help them find the right patients and engage them longitudinally. Because once users do register, like if you do go on and you register, you'll be asked for your phone number, and that you also consent to be recontacted off platform. So we can push out incentivized surveys to check outcomes, additional nudges to seek care, additional brand promotions, really, you name it. But that ability to capture patients longitudinally is really unique. Frankly, there's no one else out there doing this. And that's a big part of our value proposition to our pharma clients, as well as their agency partners.
Definitely important. Okay. Great to hear that. So then how would somebody usually find out about Ubie Health? What is the top client acquisition channel there for you guys?
So right now, I mean, this is a growth area for us. We're actually working on diversifying our channels right now, because at the moment, and frankly in Japan, search is our one channel. It's almost all Google search ads, where we're running low cost ads for symptom keywords. So we're going upstream of the disease names. Once a patient knows that they might have, cystic fibrosis, they search for that, and they're going to find the pharma websites. They're going to find the patient advocacy group sites. Where we're competing is much further upstream of that. For the users who don't know what to search for in the first place, those unknown patients. And that's our main user acquisition channel. In Japan, I would say SEO has been the biggest driver of our user growth. With that network of clinics and hospitals, we were able to develop such high domain ranking with Google that we frankly don't need to worry too much about user acquisition. Although we did just run our first mass media TV spot a couple weeks ago with one of the stars from Netflix's House of Ninjas played a role, and it's super Japanese. It's kind of hilarious to hear about. Like, Ubie in Japanese means finger, but it also implies guidance. So the idea was, Ubie, you're going to get guided to the right care via your fingers. And so we, this, fairly prominent movie star or TV star play someone's finger, like an anthropomorphic finger in the ad. It's so Japanese. It would never fly in the US, but it's fascinating to see.
All right. Awesome. Great to hear that. And so that where our listeners who are tuned in could go ahead and, to try you guys out. They could always visit you at ubiehealth.com. What role then is the website then for you guys? I mean, I know it's the primary, but is there anything behind it that seems that is going on behind their current?
Yeah. So, I mean, so right now, we have relatively little inbound presence on our B2B site. So the main landing page, if you go to ubiehealth.com, that's the web app. That is like the meat and bones of the platform. But of course, we also have our corporate pages and our sort of client landing pages. So we've got our got content about what we do for pharma and content about what we can do for provider orgs, et cetera. And that side of the marketing, the B2B marketing side, is something we're thinking about very strongly. We have a decent presence on professional social media, I think mostly LinkedIn, of course, and pushing more intelligence onto that page. I've been doing some digging on Pathmonk. It could be interesting at some point. So I was thinking about that quite a bit as I prepped for this. But yeah, it's mainly the web app is the main focus of the website and of our web strategy in general, which focuses, as I mentioned, a lot on SEO. So building out partnerships with organizations, like we actually just announced a partnership with the American Kidney Fund yesterday on July 18th. And that is focused on both user acquisition as well as SEO. So thinking about the backlinks we can create, thinking about posting a version of our symptom check on their website eventually. I'm excited to see where that goes, because ultimately everything we do is about patient value.
Exactly. I would agree with that. So on that note, then, to that way, maybe you could give us, or our listeners, give a little bit of a tip or strategy or method, something that you would recommend to our listeners to get some website lead generation.
Yeah, I mean, I think that never underestimate the power of a good backlink. I would also think, as you think about who to create backlinks and partnerships and announcements with, make sure you're thinking about what the actual end user value of your platform is going to be, and making sure that those incentives are aligned. So patient advocacy groups are such a beautiful natural fit for us. We are trying to help patients find the right resources and care. Guess who's pushing out the right resources? These advocacy groups. But also, guess who doesn't have a ton of experience using tech, developing innovative tools, building user traction? So find those win-wins and then go after them hard. And don't just think about this from an SEO or website perspective. I also lead most of our sales initiatives. And as part of that, we've gotten 2 very good leads out of our first 2 patient advocacy group partnerships. So it can do a lot for you to build the right partnerships. More tactically, make sure you're listening to your end users. I mean, we've done thousands of hours of user interviews, just trying to be relentlessly focused on the UX of our tools. That'll never stop. And frankly, if I'm being transparent, where we haven't done enough of that data collection, of that experimentation and feedback collection, is on the B2B side of our website. So make sure you're doing data collection everywhere you can. Make sure you experiment, then iterate, and then iterate some more. It never ends. You just got to constantly be refining and leverage your designers. Definitely make sure that you're not building graphics on your own. I made that mistake in previous startups, and it makes all the difference in the world and doesn't have to cost a ton of money to get some real high quality design help.
Definitely some great advice. Thank you so much for sharing that with our listeners. Well, let's switch gears then a little bit, Xander, and let's talk about you as a leader there at Ubie. What are some key tasks you like to focus on your day-to-day work being the head of growth?
Yeah, I mean, being head of growth means a lot of things. When, Ubie is, I don't think I really mentioned the corporate history. We're actually a Japanese startup. So we are quite big in Japan. We've got over 10.5 million users every month. Most of that's still in Japan, but it's growing quickly in the US. So the global team is very small, but we're building on top of a very big corporate foundation. And as sort of the commercial leader leading the US expansion, my role encompasses everything. I'm a healthcare generalist. I come via med school, consulting, multiple startups. And so I've seen a lot. And so I'm involved in everything from product to execution to sales to marketing. So day to day is all over the place. But a big part of what I do is mostly on the sales front and the B2B marketing. So I think a lot of time is spent on LinkedIn, engaging folks, prospecting, a lot of sort of thought leadership content in terms of my posts, and then just a ton of sales calls. I probably have at least 5 to 15 plus meetings with potential clients a week. And that takes up a lot of my time.
Yeah, but that's nice, right? If they're there, that's good to see. And in those between times, right? Say you do have a little bit of free time in there. How do you like to stay up to date with all the news in the marketing world as far as trends, strategies? Is there a preferred channel they like to go with?
That's a great question. I mean, in the pharma marketing world, there are a couple great resources out there. I'm a big fan of MM+M. It's a Haymarket publication focused on pharma marketing. Also would recommend PM360 is, again, pharma marketing focused. Fierce also does a great pharma marketing oriented newsletter. So I try to keep up on those. It's a constant battle though. A lot of it is just opportunistic, just catching up in the interstitial times, as you said. But it's challenging because there are relatively few great resources in pharma marketing in particular. I recently discovered the Ad Ops subreddit. If you're not familiar, it's a wealth of knowledge. A lot of it's a bit over my head, transparently, but there's a great amount of knowledge on there, and people do ask more basic questions that are more my level too.
All right, perfect. And then let's just switch gears a little bit here, Xander, and let's jump into our next section, which is our rapid fire question rounds. Are you ready for them?
Yeah, let's go.
All right, perfect. First off, then, what is the last book that you read?
The last book I read was, this is such a nerdy answer, I was dreading this question, was Swan's Way by Michel Proust. It's a bit of a beast, but I really enjoyed it. It's not nearly as daunting as people say.
All right, perfect. All right. Next up then is, if there would be no boundaries in technology, what would be that one thing that you want to get fixed for your role as a marketer today?
Ooh, all right. If there were no boundaries, and I'm going to expand in technology to expand to some regulatory concerns, some ethical concerns too. If patient level data was more accessible, it would solve so many challenges in healthcare. If pharma marketers had the ability to look at what's actually happening in patients' care, and ideally, if they could listen into the clinic and understand how patients talk about their care and how doctors respond to that, I think pharma could do so much more to improve how patients understand their health, how patients get onto therapy. There are a lot of obvious problems with that. If that was a pie in the sky, we would have to have some really cool privacy enhanced technology stuff that well outside of our scope here. But I think that would be the single biggest piece. At one point when I was with the consulting org, I saw firsthand how a huge multinational pharma, their marketing departments couldn't access patient level data, even though they had licenses to it for other departments. It's just such a frustrating challenge. Empower your teams with data is the takeaway that applies well beyond pharma.
That's fine. Okay. All right. Awesome. Great to hear that from you, Xander. And next up then is, you have a lot of experience in the marketing world, no doubting that, but what would be that one piece of advice that you would give yourself if you were to restart your journey as a marketer today?
Really great question. As I mentioned, I don't come from a marketing world. I'm a healthcare generalist. I've gone to med school. I did clinical research. I've done a lot of just healthcare specific startups. So if I could go back, I would say, look into marketing more seriously from the get-go. It is just such a fascinating world, and there is so much applied technology in the marketing landscape in a way that is very challenging in more tightly regulated spaces like healthcare tools and data tools. So I probably would focus a lot more on marketing from the get-go.
Okay. All right. Perfect. Great advice there for everybody. It's important, right? I think in today's world, it just keeps evolving. So definitely a tool that everybody needs in their bag. Well, Alexander, we are coming to the end of the show here today, but before we do end, I do want to give you the last word. So the listeners forget everything about what the episode was today. What would be that one piece of advice that they should remember about Ubie?
Yeah, I would say the biggest thing is use us. Use us to find the right information. It can really, you'll be shocked how easy it is to find highly targeted content that would take you minutes, hours, days to find the right content. I still go on here, and even with some clinical background, I'm still shocked by the things that it spits out. And trust reputable sources. Don't take every piece of advice you hear on TikTok or Instagram. There's a lot of trash out there. It's great and targeted. Their algorithms do an incredible job, but the content quality matters a lot.
Definitely. And well, our listeners, you could always check them out at ubiehealth.com. You could check your symptoms and find possible causes. It's free, just 3 minutes, and it's developed by doctors. Xander, thank you so much for being on with us today. To our listeners, thank you so much for tuning in, and I'm looking forward to our next episode at Pathmonk Presents. Thanks a lot, Xander.
Thank you.